Gentleman from Maryland, Mr. Sarbanes.
Thank you, Madam Chair. First of all, I want to salute the staff of the committee for just the incredible work over so many days, which I know is going to continue, and for being so gracious to all of us who are trying to get our ideas worked into the mix. This is a big bill. It's a complex bill. There's no question about it. But, you know, many of the things in this bill are things that we've been working on for years. We've seen them before. Many of them have been introduced as standalone bills and have been reviewed at length by members of this committee. So it's not like this appears out of whole cloth. This is putting together a lot of good material that we have been working on for months and years now. I do appreciate the committee's willingness to incorporate some ideas that I and others have been supporting and pushing over the last few weeks and months, in particular those that relate to workforce investment and also moving more in the direction of primary and preventive care, which I think is going to make a tremendous difference to the system going forward. I think this is a good bill. I mean, we've heard a lot of people criticizing it, obviously from the other side, and they're trotting out all the arguments that you would expect. But fundamentally, this is a sound bill. It's a good bill, and it does the things that Americans have been crying for a long time now. It attacks waste in the system in a significant way, which is going to lead to reduced costs over time. It breaks the stranglehold that the private health insurance industry has had over the system for so many years. It does that in a number of ways, but I'll just point out a couple. One is no more discrimination based on pre-existing conditions. Just about every family in the country has some perspective on that struggle. And so that's a critical element of this bill. The other thing it does is it puts this public option into the mix, this public plan option into the mix to help create more competition. It's not about driving the private health insurance industry out of business. That's not going to happen. I spent 20 years working in healthcare, representing providers and dealing with these private health plans. They're going to be just fine. They're going to be just fine under this new system. All we're doing is saying let's put some more options into the mix so we can give Americans more options. And as I said, it invests in the workforce and in primary care. A little bit earlier, I heard somebody on the other side say, if it ain't broke, don't fix it. Well, it's broke. And most Americans understand this. They've moved past the need for a public plan option for health care reform. They understand that we have to do this. And if we go back to our districts and we haven't made this change, they're going to be saying to us, the uninsured, the underinsured, and the insured that are paying 20% premiums every year, weren't you listening to us? So in closing, let me just say, at various times over the last few decades, we've tried to fix this system. We've come close, but special interests have stood in our way. Not this time. This time, we're going to keep our nerve. We're going to push through, and we're going to bring a good bill home for the American people. I yield back my time.
Thank you, Mr. Sarbanes.